You know, when a new virus pops up or a big public health crisis hits, have you ever wondered who the scientists are on the front lines? Well, in this explainer, we're going to take an insider's look at the incredibly complex and frankly vital world of India's medical research organizations.
Hello, this is Dr. Sharif Mohammed, a research specialist. I'm going to present on the medical research bodies in India. So, there you have it, straight from our expert guide. We're here to understand the organizations that form the very backbone of the nation's health security.
So why does all this bureaucracy and structure actually matter? Well, it's because the science that comes out of these places directly impacts everything, from the vaccines you and your family get to how the entire country responds during a pandemic. We are talking about the health and safety of 1.4 times billion people. The stakes couldn't be higher.
All right, so to really get our heads around how this all works, we've got to start at the very top. Let's take a look at the governance structure that oversees this whole massive operation.
It all kicks off right at the apex with the Ministry of Health and Family Welfare. Now, within that ministry is the Department of Health Research, or DHR, which was set up back in 2007. Its whole mission is to be the primary driver, kind of like the steering committee, for all national health research.
And this slide right here illustrates the chain of command perfectly. You've got the DHR at the top setting the big picture strategy. That policy then flows down to the Indian Council of Medical Research, the ICMR, which really acts as the operational headquarters. And then the ICMR manages this huge network of specialized institutes that do the actual, on-the-ground, hands-on research. It's a very clear top-down system, and it's all designed for efficiency.
So, let's zoom in on that critical middle piece of the puzzle, the ICMR. If the DHR is the brain of the operation, then the ICMR is absolutely the engine. It's what makes everything go.
And here it is. The ICMR is the main national body for all things medical research. And just look at that founding date, 1911. We're talking about an institution with over a century of experience in tackling India's biggest public health challenges.
So what does the ICMR actually do? Well, it wears a lot of hats. It doesn't just do research itself, it sets the national priorities, it funds other projects, and, this is crucial, it creates the ethical guidelines for all biomedical research in the country. And during emergencies, like COVID-19 or the Nipah virus outbreak, it becomes the #1 scientific advisor to the government.
But here's the thing. The ICMR isn't just one building in New Delhi. Not at all. Its real strength, its power, lies in its sprawling, nationwide network of highly specialized institutes. Let's see how this all plays out across the country. 27. Just let that number sink in. That's how many permanent national institutes and centers are operating under the ICMR. This huge network makes sure that cutting-edge research isn't just happening in the big cities, but it's spread out all over the country to tackle very specific regional and local health problems.
And the level of specialization here is just incredible. This slide gives you just a small taste. You've got the National Institute of Virology in Pune, which, as you can imagine, was absolutely central to the COVID-19 response. Then there's the Institute of Nutrition in Hyderabad, a dedicated center for tuberculosis research in Chennai, and even an institute in Jabalpur that focuses specifically on the health of tribal populations. Each one is a powerhouse in its own field.
Okay, so while that DHR-ICMR axis is the backbone of the whole system, it doesn't operate in a vacuum. It's actually part of a much larger ecosystem of players, all working together for the nation's health.
This table does a great job of laying it all out. You have scientific bodies like the Department of Biotechnology that are pushing innovation in vaccines and genomics. You have the super important regulatory gatekeeper, the CDSCO, which approves new drugs and trials. And of course, you've got a massive private sector. It's this interplay, this dance, between public strategy and private innovation that's essential for everything from drug development to huge clinical trials. Honestly, neither side can succeed without the other.
Now, a system this complex didn't just appear overnight. It's been built up, piece by piece, over decades, and it continues to evolve and adapt to meet the challenges of our constantly changing world.
And this timeline really paints a clear picture of that evolution. You know, it started in the colonial era with a narrow focus on tropical diseases. After independence, the game changed. The priority was building national institutions to fight widespread communicable diseases. And today, it's a completely different world, dominated by things like genomics, digital health, and these complex public-private partnerships. The key takeaway is that the system is always reinventing itself.
So where's all this headed next? Well, a key concept for the future is something called One Health. It's this growing understanding that you can't separate human health from the health of animals and the environment we all share.
Think about it. Diseases that jump from animals to humans, like bird flu, or, yep, even COVID-19. The future of research is tackling these problems holistically, knowing you can't protect people without also thinking about animal and environmental health.
And that leaves us with a final, really critical question. We've seen this powerful, complex network that's been built over a century. But as health threats become more global, more unpredictable, and more complex, how must this amazing system continue to adapt to protect the health of 1.4 billion people, and maybe even the rest of us?